Swallowing exercises for patients with head and neck cancer who are starting radiation therapy. How radiation treatment can cause swallowing problems. Radiation treatment to the head and neck area can cause many side effects. Some of the side effects can result in short and long-term swallowing problems. Short-term swallowing problems are due to changes in saliva, thick mucus, pain, and swelling in the mouth and throat, which can make it difficult to swallow. Long-term swallowing problems can set in months or years after treatment has finished. Muscles in the mouth and throat can become stiff, making it difficult to safely and easily swallow food, liquid, or even your spit. How swallowing problems can affect your health. Swallowing problems can make eating and drinking difficult. If left untreated, swallowing problems can cause weight loss and dehydration. In some cases, it can result in an aspiration pneumonia. This is a lung infection caused by bacteria from the mouth and throat getting into the lungs when food or drink goes down the wrong way into the windpipe when swallowing. What can you do to prevent swallowing problems? We use 30 muscles when we swallow. It is important to keep these muscles working well. You can keep your swallowing muscles working by continuing to eat during treatment if it is safe to do so, and by doing swallowing exercises during and after treatment has finished. There are 5 exercises shown in this video. These exercises help to strengthen and stretch the muscles in your mouth and throat. These are 1. The effortful swallow, 2. The Masako Technique, 3. Jaw range of motion exercise, 4. Tongue range of motion exercise, and 5. The Supraglottic Swallow. Exercise 1 and 2 help to strengthen your throat muscles. Exercises 3 and 4 help to stretch the jaw and tongue muscles. Exercise 5 helps to protect your airway when swallowing. It is best to begin these exercises 2 weeks before treatment. Do these exercises 3 times a day during treatment. If you cannot start these exercises before treatment, start them as soon as you can. Do these exercises once daily after treatment is done, as part of a maintenance program. Before you begin these exercises, make sure you have the following items. Mouth rinse solution. This may be a baking soda rinse, salt water, or flat club soda. Your mouth rinse will help you get rid of mucus buildup in your mouth and will keep your mouth moist between exercises. Water to sip and swallow if your mouth feels dry. If someone on your healthcare team told you it is not safe to eat or drink by mouth, do not swallow any water. Only rinse your mouth with your mouth rinse if your mouth becomes dry. A small bowl to spit out your mouth rinse. You can also spit your mouth rinse in a sink. Tissues to wipe your mouth. And a small mirror to help you see how well you are doing each exercise. The first 2 exercises help to strengthen the throat muscles. Exercise 1, the effortful swallow. And Exercise 2, the Masako Technique. Now, we will begin with the exercises. When we swallow, the back of the tongue and muscles in the throat work together to push food down towards the food pipe. Strengthening your throat muscles will keep those muscles working well. This may help prevent food from sticking in the back of your throat when eating and drinking. To begin, sit comfortably with your mouth relaxed. Press your tongue against the roof of your mouth as hard as you can. With your tongue in this position, press your lips together and swallow as hard as you can. If you are able to eat by mouth, you can do this exercise with each mouthful after you chew your food. To do this exercise with food, chew food well and then swallow hard. It is normal for your mouth to feel dry when you are doing this exercise. If your mouth feels dry, take a sip of water or use your mouth rinse solution to keep your mouth moist. Pause this video and repeat the exercise 5 to 10 times. Exercise 2, the Masako Technique. To begin, sit comfortably with your mouth relaxed. Stick out your tongue slightly. Hold the tip of your tongue between your teeth. Keeping your tongue between your teeth, try to swallow your spit. To make this exercise easier to do, lower your head slightly as you swallow. If you had surgery to your tongue, it may be hard to get the tip out between your teeth. Do your best to stick your tongue out as far as you can. As a tip for each exercise, if you are not sure how well you are doing the exercise, use your mirror. This will help you see what you are doing. Pause this video and repeat the exercise 5 to 10 times. The next two exercises help to stretch the jaw and tongue muscles. Exercise 3, jaw range of motion, and Exercise 4, tongue range of motion. When we take a bite of food, the muscles of the jaw and tongue help with chewing, controlling and moving the food and drink from the front to the back of the throat. Exercise 3, jaw range of motion. This exercise will help prevent stiffness in your jaw. Before starting the jaw range of motion exercise, let's talk about trismus. Some patients are at high risk for getting trismus. Trismus is a condition that affects the muscles that move your jaw. This will make it harder to open your mouth and can make day-to-day activities such as chewing, talking, and brushing your teeth more difficult. To get more information about trismus, you can review the pamphlet, Are You at Risk?, found in your new patient package, or talk to a member of your healthcare team. To begin this exercise, sit comfortably with your mouth relaxed. Open your mouth as wide as you can. You should feel a good stretch but not any pain. Once you are in the position, hold it for 5 seconds. Relax your jaw for a few seconds to give your mouth a break. Now move your jaw to the left. Once you are in the position, hold it for 5 seconds. Relax your jaw for a few seconds to give your mouth a break. Now, move your jaw to the right. Once you are in the position, hold it for 5 seconds. Relax your jaw for a few seconds to give your mouth a break. Pause this video and repeat the exercise 5 to 10 times. If you are able, hold each position for a full 5 seconds. This will make sure you give your jaw a good stretch and have better results. It may help to count in your mind slowly to make sure you get a proper stretch. Exercise 4, tongue range of motion. To begin, sit comfortably with your mouth relaxed. Stick your tongue out as far as it can go. Do not hold your tongue between your teeth. This will make sure you give your tongue a good stretch. If you had surgery to your tongue, it will be hard to move your tongue out. Stick your tongue out as far as you can. Once you are in the position, hold it for 5 seconds. Relax your tongue for a few seconds to give your mouth a break. Now, move your tongue up towards your nose. Once you are in this position, hold it for 5 seconds. Relax your tongue for a few seconds to give your mouth a break. Now, move your tongue down towards your chin. Once you are in this position, hold it for 5 seconds. Relax your tongue for a few seconds to give your mouth a break. Now, move your tongue to the left side of your mouth. Once you are in this position, hold it for 5 seconds. Finally, move your tongue to your right and hold for 5, 4, 3, 2, 1. Relax your tongue for a few seconds to give your mouth a break. Pause the video and repeat this exercise 5 to 10 times. If you are able, hold each position for a full 5 seconds. This will make sure you give your tongue a good stretch and have better results. It is normal for your mouth to feel dry when you do this exercise. If your mouth feels dry, take a sip of water or use your mouth rinse solution to keep your mouth moist. Exercise 5, the Supraglottic Swallow. This exercise works on the muscles in your airway. Good airway protection is important when swallowing to make sure food and drink doesn't go down the wrong way into the windpipe. To begin, sit comfortably with your mouth relaxed. Take a breath in and hold your breath very briefly. Swallow and then cough when you exhale. Do this exercise in a smooth motion. Do not pause between steps. Let's do this exercise one more time. Take a breath in, swallow, and then cough when you exhale. Pause this video and repeat the exercise 5 to 10 times. Once you feel comfortable, you can do these exercises anywhere, for example, in your car, in your living room, or in the waiting room before your appointment. If you have any trouble doing these exercises, talk to a member of your healthcare team. Remember, when you start treatment, do these exercises 3 times each day if possible. Continue these exercises once a day after you finish treatment. Watch this video as often as you need. It may take some practice to be able to do these exercises well. In this video, you have learned 5 exercises to help strengthen and stretch your swallowing muscles. These are 1. The effortful swallow, 2. The Masako Technique, 3. Jaw range of motion exercise, 4. Tongue range of motion exercise, and 5. The Supraglottic Swallow.